welcome to Future Choices. My name is Fran Snedeker, and I'm the producer and moderator of this educational series exploring issues around reproductive health, filmed at the LMC TV studios in Mamaroneck, New York. To set the scene for tonight's conversation, I'd like to share with you a short clip produced by some colleagues in Southern Africa. That is indeed quite a question. Why would the United States want to stand in the way of getting desperately needed family planning care to people in Zambia? The video references the Global Gag Rule, and to help us better understand the reason that they are so intent on lifting the global gag, I am very pleased to welcome to the Future Choices tonight Dr. Isaiah Ndong, who's the Vice President for Programs for EngenderHealth. Isaiah, welcome.
Thank you very much.
Isaiah, what is the Global Gag Rule?
The Global Gag Rule is a policy that was put in place by the Reagan administration in 1984. The policy denies U.S. foreign assistance, family planning assistance, to overseas NGOs.
NGO is?
Non-governmental organizations that provide abortion services or that lobby their own governments to have favorable policies for abortion. This policy also denies family planning assistance to foreign non-governmental organizations that even just provide abortion counseling or referrals for their own clients.
And so this Global Gag Rule has been in place ever since the Reagan years?
The Global Gag Rule was put in place in 1984. Mm-hmm. When President Clinton took over in 1993, the first thing he did was to lift the Global Gag Rule. Mm-hmm. When President Bush came into power in 2001, the first thing he did was also to reinstate the Global Gag Rule.
Okay, and so what, we've had the Global Gag Rule now for 8 years. Have we seen fewer abortions as a result?
The proponents of abortion, those who oppose abortion, intended the Global Gag Rule to reduce access to abortion services. Mm-hmm. What has happened is that because it also restricts family planning funding to overseas non-governmental organizations that are the primary providers of family planning services, it has reduced access to family planning for many of the women, young and old, who are getting pregnant because they no longer have access to contraception. It therefore, in fact, has increased the number of unwanted pregnancies and generally resulted in an increase in the number of unsafe abortions.
And can you give me some specific examples of where you have seen the most destructive impact of the Global Gag Rule?
I was working and living in Ghana in 2003 when the gag rule was reinstated. Mm-hmm. And EngenderHealth had as one of his key partners the Family Planning Association of Ghana. Mm-hmm. This non-governmental organization was the primary provider of family planning services, especially in the rural communities where access not only to family planning but to all health services is very difficult, and where in fact their facilities were the only health facilities for those communities. So they not only provided family planning services, they provided other health services, including services for pregnant women, immunization services for children, prevention services for HIV/AIDS. As a result of the cut in their funding, they closed the largest community outreach program in Ghana, and as a result, millions of Ghanaians lost access, not only to family planning services, but to health services overall. And in fact, this organization did not provide abortion services.
So why did they become not eligible for U.S. foreign assistance if they weren't providing abortion services?
They refused to sign on to the gag rule because they felt it limited the choices and the rights of their own people to services that the people wanted and needed.
Oh, so any foreign NGO has to under the gag rule, has to sign that they will abide by it.
To receive U.S. government funding, they need to sign that they will abide by the Mexico City policy or the gag rule.
And so all these clinics that were the only health facility in many, many small villages throughout Ghana, they were closed?
Several of them were closed. And so the communities that these clinics served lost, for many of them, their only health facility. And I have seen this in other programs in other countries where EngenderHealth works. Similar cases occurred in Kenya, in Tanzania, in Uganda, in Cameroon. The cut in funding didn't only cause clinics to close. The U.S. government was the main donor for contraceptives. It didn't only fund services, it funded contraceptives, it funded equipment, it funded organizations that provided technical assistance with training to these local non-governmental organizations. So they lost not only services, but also they no longer had supplies to continue to provide services, even in the facilities that stayed open.
Now, why couldn't the supplies be funneled through other health facilities?
The access, because the U.S. government also was the main donor of contraceptives to the country as a whole, cuts in funding for family planning limited the amount of contraceptives that went into some of these countries. Also, some of these countries received direct supplies from the U.S. government without them having to go through their own countries and systems. And therefore, the direct cut of supplies to these organizations severely limited access to services by their clients.
And this happened in all across the world for any country, any NGOs that were foreign NGOs, not American NGOs, but foreign NGOs.
Foreign NGOs. And it happened across the world. But as you know, Africa south of the Sahara has the highest need for family planning services. It has the highest maternal mortality, it has the highest infant mortality, and also has the highest prevalence of HIV/AIDS. So it was much more affected than other parts of the world.
And made a lot more difference to these countries that were, like Ghana, at the cusp of breaking into not being a developing country, but a mostly developed country.
Yes, it made the greatest, the worst impact was felt by the least developing countries who could least afford a replacement of the funding and support that they were receiving from the U.S. government.
And how does this impact your work with EngenderHealth? Perhaps it would be a good idea now to talk a little bit about what EngenderHealth is, so that we can understand how the Global Gag Rule impacted your work.
EngenderHealth works in the world's poorest communities to improve the quality of health care, to ensure the rights of the peoples in those communities to health care, and to help empower the people and build their capacity to strengthen and create systems for healthcare delivery that last. And because we work through these local organizations, the reach of our work, the extent of our work was limited, because the key local organizations that provide these services through who we work could no longer receive support from EngenderHealth for programs that were funded by the U.S. government.
And so the work that you were able to do then was restricted to the governmental institutions, and what?
So the work we did was restricted with working with the government institutions. But in many of these countries, the government institutions are incapable of meeting the health needs of their entire population. And so these local non-governmental organizations do partner with the public institutions to provide healthcare services to their people. And in some places, in fact, these organizations are the only ones that have health facilities. The government doesn't duplicate those services in places where these local organizations are working. And so in places where these organizations worked exclusively, the cuts meant cut in health services overall for the populations that they served.
Now, it sounds to me that as if not only did it cause a cut in services, but family planning, in maternal health care, in child health services, sounds pretty undemocratic because it restricts free speech, and there's an inefficient use of our foreign assistance funds. I would think that the Congress, the members of our Congress would be pretty unhappy with the Global Gag Rule. What have we heard from our U.S. representatives and our senators?
The gag rule didn't only restrict funding, U.S. government funding for those services. It restricted those organizations from using their own funding or funding from other sources other than the U.S. government to provide any services related to abortion. And there are U.S. congressmen and women who have been very, very upset by the gag rule. And in fact, last year, the congresswoman for New York, Nita Lowry, visited Ghana. And one of EngenderHealth board members, Dr. Afusu Ama, took her to see the effects of the gag rule on the Planned Parenthood Association of Ghana services. So they have been very concerned. They have been to the ground to see the negative effects of the gag rule. And I know and have talked and visited with Congresswoman Lowry that she's working very hard to try to get the gag rule lifted.
Didn't she hold
hearings in Congress?
Hearings that really revealed? And was the head of Planned Parenthood Association of Ghana not at the hearings?
They held hearings and in fact did invite the president of the Planned Parenthood Association of Ghana to give testimony at those hearings, and other organizations that were affected around the world. And so there have been hearings in Congress, and this demonstrates the concern, the serious concern they have about the effects of the gag rule. And
they tried to lift it, but...
They tried to lift it, but it was difficult under the current under the Bush administration to get that done. And therefore, one of the actions that we sincerely and do hope that the Obama administration will take in its first 100 days will be to lift this gag rule.
And this is all very interesting, but why should we here in Westchester County be very concerned about the Global Gag Rule?
I know that the people in Westchester County are concerned about the health of women and children around the world, and not just here in this county. And so I'm sure they will be appalled if they understood the negative effect that the gag rule is having on the health of women and children and of people running the risk of being infected with HIV, AIDS, because they can't receive the services they want, they need, and because the organizations that can provide them these services have their funding assistance from the U.S. government cut.
So, okay, what can we do as private citizens that need a Lowy and are very eminently pro-choice senators from New York, stuff that they haven't already tried?
I think they should continue to try. There is going to be a new administration, so we have the hopes that if we try again, we have a better chance of success with the new administration. We will urge all the people of Westchester to visit EngenderHealth website, EngenderHealth.org, and sign a petition on our website that we're appealing to the new administration to leave the gag rule. But we'll also appeal to them to continue to make calls to their Congress people, to their senators, not just here in Westchester, not just in New York, but around the country, to let them know, let them hear from them how they feel about the negative effects of the gag rule on the lives and health of women and children around the world.
And so you're saying that if we go to the EngenderHealth website, there will be right there an obvious link that so that they can sign a petition to urge the president to repeal the Global Gag Rule?
Yes. Again, the website address is www.engenderhealth.org.
Excellent. And if we go to the website, we sign the petition, and if I should say when the president repeals the Global Gag Rule, what changes will we see? Will these clinics reopen? What can we hope for in the near future and a little bit longer?
I was in Tanzania in November during the election. And there was great excitement and expectation. I visited one of the Family Planning Association clinics to see how they were doing. We had been supporting these clinics before the gag rule was reinstated. And they really are anxiously waiting, expecting this to be lifted so that funding can be reinstated, but much more so that organizations like ours can resume the support we provided to them in building their capacity in order for them to be able to meet the needs of their communities.
So all over Tanzania, you're saying that people in family planning services are aware of the politics of the United States. The Global Gag Rule is likely to quietly disappear under President Obama?
Definitely, because the effect of the gag rule has been so widespread. Clinics have closed, programs have closed, people's lives have been affected. And of course, the people needed to understand why those clinics were closing, so they know why those clinics have closed. They know it's because of the gag rule. And so they are anxiously expecting the gag rule to be lifted so that funding to these organizations can resume and so that these services could be restarted or expanded.
Sounds as if EngenderHealth is finds that as a big priority for the Obama administration. Are there other action steps that you would like to see?
Definitely. We want the gag rule to be lifted. The gag rule provides funding for family planning, but we also know that for many years now, the funding has been limited, but the demand has increased. There is a large youth population that is going to hit reproductive age very soon. And so not only do we want the gag rule lifted, we want the funding for family planning to be significantly increased. so many women are still dying. A woman dies every 1 minute from a pregnancy or delivery-related cause. And yet, we know what needs to be done to stop these women from dying. The resources are limited. So we will also be appealing to the new administration to pay more attention and increase funding for maternal health. The U.S. government is putting in a lot of money into HIV prevention, care, and treatment, and they need to be recognized and congratulated for that. But they've also put some restrictions that make these resources less effective. The abstinence, the focus on abstinence for prevention needs to be lifted so that people can make choices of the prevention methods that best fit them. They also need to lift the restriction of funding to organizations that work with sex workers or prostitutes. These are a group of people who are at high risk, but there is also restriction of funding to organizations, the HIV funding to organizations that work with sex workers and prostitutes. Yes. And so we would also like these to be lifted, the HIV funding to continue, but these to be lifted so that the funding can become more effective. And we also would like the administration to focus attention and resources on the reproductive health needs of young people.
And I think we've also had guests on previous programs of Future Choices about the importance of funding the UNFPA again. Does EngenderHealth work with UNFPA?
Yes, we work with UNFPA, and UNFPA works with all the governments with which EngenderHealth works. And they provide a lot of support and technical assistance to the Ministry of Health in design and implementation of their reproductive health programs. And so their activities have been limited because they received very significant support from the U.S. government, which also has been cut in the last several years. So reinstating the funding to UNFPA will also be one of the priorities we hope the administration will deal with.
And that's been throughout also the last eight years that the UNFPA has not been funded.
They've not been funded.
Okay, so another action step for Obama. Well, you certainly have made it clear that EngenderHealth is involved in a wide variety of activities as far as helping other health institutions in developing countries to improve their services in HIV/AIDS, in maternal health care, in family planning, etc. But all the action steps that you just talked about, asking the president to do, were governmental action steps. Is all of EngenderHealth's work funded purely by the federal government?
No, we receive a significant amount of support from the U.S. government. A lot of our programs are funded by the U.S. government, but we also do get funding from foundations, from corporations, and from individuals.
So that when anybody goes to the EngenderHealth website to sign the petition, if they decide to wander off into the donate here column, that would be welcome also.
Definitely. The resources we receive in no way can meet the needs that are out there. The needs by far exceed the resources we have. And we rely on the U.S. government funds, the foundations, but also individuals to contribute to support the work which we do with these local organizations to help them meet the health needs of their populations. So we would definitely greatly appreciate any individual, family, foundation, corporate donations that we receive. And there is a link at www.engenderhealth.org where you can sign in and make a donation to Engender Health to support this work which we're doing to improve the health and lives of people in the poorest communities of the world.
I can see that the work that you are doing is very important. But I wonder if you could sort of summarize for me why it is that Engender Health is so disturbed by the Global Gag Rule.
The Global Gag Rule has in fact indirectly denied badly needed services to some of the world's poorest people, especially women and children. Mm-hmm. Engender Health cares so much about the health of women and children. And so we are very concerned about the fact that they can't have access to the health services they need. And that is why we really want the gag rule to be lifted as soon as the new administration comes into office.
Well, Isaiah, I want to thank you very much. You have made it very clear that that lifting the Global Gag Rule is of paramount importance. And I wanted to turn to my friends and neighbors in Westchester County and urge you, please, to go to the Engender Health website and sign the petition asking the President Obama to lift the global gag, to repeal the Global Gag Rule, and to ask your family and friends to go sign that petition also. It's so important that we do this one small thing which could have such a huge impact on women and their families throughout the developing world. There will be piles of pressing issues for the president to consider when he comes into office. And by keeping his focus on the need to lift the global gag, we can do a huge service to women and children throughout the world, and also to make a major step in improving, restoring the international reputation of the United States as a good friend and neighbor to the rest of the world. Thank you, and good night.